All right, my name is Tobias Martin. I am a student at Robertson College, currently in the Veterinary Assistant program, and I'm going to show you some restraint techniques for canines and a couple other procedures that we go through. Unfortunately, I do not have a dog to use at the moment, and the closest stuffy I have would be a raccoon, but it is, I guess it could be similar to a pug or a smaller dog breed. Legs are kind of closer to the ground and all that, so I guess we'll be using this. But first, we have about 6 different things that we're going to go through. We're going to start with a slip lead and putting it on the canine. Unfortunately, I do not have a slip lead, so the best thing I could come up with was a makeshift one, which unfortunately is made from a phone charger, which is not the most practical, although it kind of works in the same way that a slip lead would. So what you're going to want to do is give more room in the loop than would be necessary. You can hold it open with your fingers. Obviously, it's not really staying open as well as a actual leash would because it's a phone charger and made with wire. But either way, you're just, we're just working with what we have. So what you're going to want to do is put it over the animal's head near the front, and then quickly put it over like that. Obviously, if it was a slip lead, it would be a bit easier to do it with. I wouldn't have to necessarily use both of my hands just because it would tighten on its own around the animal's neck. But this is the best option we have at the moment. And then we're going to also take it off, which it's not really realistic to what would happen, because if this was a aggressive dog, having your hands near its face would not be the best option. But we're just gonna, slide this out of the loop here, makeshift loop, and take it off of its face here. So that's the best I could come up with, unfortunately, for the slip lead. We'll just put that over here. Next, we're going to be doing a bear hug restraint method, which is pretty simple in practice. What we're going to start with is using our one arm to wrap it around and underneath the dog's neck and holding its head close to your body to just control its movements. If it's aggressive, you don't want it biting the vet technician or the vet. So we're going to start with that, and then next we're going to use our other arm and wrap it around the dog's body, kind of like so. Because this would be a smaller dog, it's much easier than controlling a larger dog. I can just hold it near my body while the vet goes through the procedure, whatever it is doing, an examination. But we're just going to keep it close to the body, put slight pressure on the head, but nothing to make it uncomfortable. And just hold it like so, and then you can let go to finish up the procedure, the restraint. Alright, so next we're going to put the animal in a position and also hold it for cephalic blood collection. Obviously this is a raccoon, so we're going to imagine it's in a standing position somewhat. It's not entirely, but this is the best thing we're working with right now. So for the time being, it's in a standing position, low to the table. So first we're going to put our arm around the animal's neck, and similarly to the bear hug, and hold it close to our body, like before, putting pressure on the head so it's not moving around too much. Next, we're going to kind of put our forearm around the body, holding it close. We are going to grab the front arm behind the elbow, imagining this is kind of the elbow, and push forward a tiny bit, as much as possible. And then we are going to use our thumb right here to roll the vein forward for the blood collection. On the inside, roll it kind of outward, so the vet technician or the vet that is collecting the blood can gain better access to it. And then just make sure to keep the dog close to your body. Again, keeping the head close, keeping the body close, using your forearm right here. And once blood collection is finished, we're going to release our thumb, continue holding the leg, and then we're going to put our thumb over the area where the needle was placed to stop any blood from leaking out of the wound, and just to make sure that, nothing happens before the vet can put gauze around or a bandage. But other than that, It's a relatively simple procedure for the blood collection, cephalic blood collection. Alright, next we are going to put the animal in lateral recumbency and hold it in position. This is relatively simple as a procedure, especially when it's a smaller dog like this. What we're going to do is, obviously it's a bit of an uncomfortable position, imagining that the animal is standing up as much as possible, kind of like this. We're going to reach both of our arms around. This one goes underneath the neck, and what you're going to want to do is grab the legs closest to your body, not furthest away. We're also going to use this arm underneath the abdomen, and we're going to grab the leg underneath there. And once you have hold of both the legs, you want to make sure the dog is kept close to your body, just to provide support. And we're going to slowly pull them out from under and away from us, and lower them on their side, also keeping the dog close to your body while doing this, and laying them gently down. And just to provide support, once they're down like this, you can put your hand around its head and neck area and provide a slight pressure on it, just to make sure, again, it's not moving too much. And we can also put our hand around its body to provide more support, just to make sure it's not moving around tons, keeping it close to your body as well, just so whatever exam we're doing or whatever procedure happens, it's relatively immobile, but not uncomfortably so. All right, number 5, or second last, we are going to position and hold for saphenous blood collection. This is in the outside of the hind leg of the animal. This can be done in standing position or lateral recumbency. It's already in this position, so we'll do it in lateral recumbency, but again, if the animal was going to be standing up, following the same procedure as last time, we go underneath the neck, grab the leg closest to you, and then underneath the abdomen, leg closest to you. Keep the animal close to your body, and then turn it over, let it adjust, like so. And then we keep the arm around its body for, making sure that it's supported, as well as the head, the slight pressure on the head. And now for the blood collection, we are going to hold the front feet with one hand, using the 3-finger position. So just putting the index finger on the outside, or you can keep the thumb on the outside, index finger in the middle, the other hand's holding it like this, just so it's not moving around too much. We can still keep our forearm on the head, just not too much pressure, just enough to really keep it in position. And then what we are going to do is hold the rear hind leg above the knee. Obviously, there's not much leg to work with here, so we're just going to imagine we are holding it above the knee as much as possible. There's not much to work with, but we're going to hold it above the knee, and then the veterinarian or the vet technician would be pulling out the leg and straightening it out as much as possible. Again, the vein is on the outside of the leg here, and essentially let them take the blood, and we're following the same procedure as before. Once the blood is collected, we're going to make sure to put pressure on that with our thumb here, once the needle has been removed, and just making sure to put pressure on so no blood leaks. Again, just keeping the animal close to your body, putting pressure on that head, but not too much. The 2 front legs are held together so it's not moving around too much. And then the vet can bandage it up, put some gauze around the wound, and it should be all good to go. And finally, we have pilling the dog. Obviously, in this case, the dog would usually be sitting up. Unfortunately, this cannot really sit up, and it only really stays in this position, whether you call that standing or dorsal recumbency. Normally, you would be in front of the dog, having it facing you. For this, I'm gonna kind of have it facing the camera just so it's easier to see. But we'll just imagine in this scenario that it is sitting. In this case, but what we're going to do, I'm right-handed, so I use my left hand. We're going to use our left hand to reach around and grab the upper part of the mouth and the muzzle, kind of in a upside-down U shape. And then what we're going to do is use the outside of our right hand, kind of the pinky, if necessary, to open up the mouth, and then imagining we have the pill in our index finger between our thumb. We're going to open the mouth like so, and then put it in the back as quickly as possible behind the tongue, and then closing the mouth. It's easiest to keep the mouth closed, as well as feeling over the throat and even massaging the throat to stimulate swallowing. So just massaging it, and then hopefully at this point you will have felt the canine swallow. It might lick its lips, but worst case scenario, you can open the mouth again, like we saw before, opening it with the end, just making sure the pill was swallowed, and it's not hiding the pill anywhere in its mouth. But importantly, for this procedure, just keep it relatively fast. You're not going to want to take a really slow time just because it's uncomfortable for the dog. Obviously, this is a puppet. It doesn't have very much room in its mouth or its throat. But if it did, or if it was a larger dog, you can really, open its mouth and stick a lot of your hand down there if you need to, just ensuring that there's a higher likelihood that it swallows the pill. All right, so those were the different techniques of restraint and procedures to follow. Hopefully that teaches you as easily and clearly as possible what to do with a canine or a raccoon if you need to. But anyways, thank you for watching and have a nice day.